Thank you all for joining us and welcome to Post-Sepsis Care, What Have We Missed? A patient's perspective with our guest, Aristotle Domingo. My name is Christine Russell. I identify as she, her, and I am part of the communications team at Sepsis Canada. Before we get started, just a reminder that the Q&A is available to ask any questions of our guest speaker, and there will be time at the end for him to answer them. To start, you can enable closed captioning in either French or English by clicking the closed caption button at the bottom of your screen. To select your preferred language, click the arrow and select either French or English under Translate To. You can also view the transcript on the right by clicking View Full Transcript. Lastly, just a reminder, this webinar will be recorded and published on our website for those who could not attend in person today. Aristotle Domingo is a double below-knee amputee, an avid runner, and gold and silver medalist in men's seated field events, shot put, discus, and javelin. He is the founder of the Amputee Coalition of Toronto, a peer advocacy group providing education and support for limb loss and limb different communities in Ontario. He was given the ParaSport Ontario 2020 Athlete Ambassador of the Year. Aristotle had sepsis and will be speaking on his post-sepsis journey. To learn more about Aristotle, you can visit the links in the chat. And with that, I will turn it over to Aristotle.
Good morning, good afternoon, good evening, everybody, depending on where you are in the world. My name is Aristotle Domingo. Thank you, Christine, for the amazing introduction. Just to tell you a bit of my story and sort of to get our conversation started, I had survived sepsis back in 2001. I was diagnosed with sepsis around the spring of 2001, not knowing really where it came from or how it began. I just felt ill, as too many of you may have experienced who've experienced sepsis, being in hospital for almost a year and a half. After that, after my bout with sepsis, I've had many, not only surgeries to do corrective. I haven't actually had my amputation until about 4 years ago, and I'll get to that in a little bit. But I think what's more important or more to focus on is that immediate aftercare of sepsis, post-sepsis. So, like I said, I was in hospital for about a year and a half. I had gangrenous both hands and feet, and actually nose. And so I was going through a lot of surgeries while in hospital, and then recovering in hospital, and then 2 weeks later back into surgery. One of the main things for me after my bout with sepsis, after being released from home, was the lack of the knowledge that my family has either received from my medical care team, albeit they tried their very hardest to explain what was going on with my body. But I think for me as a patient as well, not knowing a lot about my condition and what I was looking forward to was the hardest part of growing into this journey or finding myself in the journey. It was a lot of not only finding for myself, and to be honest, I wasn't very much of an advocate for myself at the beginning too. I accepted my disability as is, that I was never going to walk again, and I was going to go through the suffering of continued infections throughout my life, not knowing what was on the other side of that. So I just took it as what my doctors would be saying to me, that what was wrong with me at the time. And I think the lessons learned from that is, and hopefully the lessons you will take away from today as well, is looking at the bigger picture of the patient's care instead of only addressing the immediate ones that are right up front or when it happens. I think there's a lot to be said when it comes to really looking at the overall sort of journey or quality of life for the patient. When we look at it from a big picture, instead of, well, you have a bone infection, let's go fix that now. And then the care stops. Then I will have another bout, but now I have, a heart attack or other, issue with my health, and we will fix that. And then that's the end of that. So I think from an overall care and quality of life, I think to me that would be the bigger picture from a research point of view, to look at really what is that long-term post-sepsis syndrome, or what is that really that long-term care that we should be focusing on the patient so that the patient experiences less of this, and that we prepare not only the patient, but their family as well. One of the biggest things, and I'll share this and I'll open the panel for to ask questions as to what my, more details of my experience. One of the things with me was, again, sort of in the dark. I was in my 20s at the time, sort of in the dark of what's happened really to me, and getting the secondhand knowledge from what was given by my medical team at the time with my family. So, in hindsight, being talked about it afterwards with my family, it's like they told us not to tell you what happened. They said that you will have these mood swings, but we should not mention it, and that we should just take it for what it is, because you're on high meds, and your body will go through all of these. Meanwhile, I have no actual understanding of what was happening with my body, and I think that was the most difficult one, because then the patient suffers alone, and I think that prevents a lot of times for the patient and the survivor, or the survivor, if you want to put it that way, to actually seek support and help, because we're not understanding what's going on with our body. So I think, to really give that understanding, post-care, post-sepsis, and to actually identify what could the person or what could the survivor be expecting to experience or may experience, will help a lot in the way that the patient move on with their quality of life, whatever that looks like for them, moving beyond sepsis. So I think what you take away from today, and from my experience with post-sepsis care, is that, what can we walk away with that will ensure that we can look after patient not from a case-to-case basis after sepsis, but in a long term, what should be the whole outlook that we should provide the patient, so that they know what's going on with their system, and we know how to address healthcare. So with that, I'd like to open up the table, the forum to any questions you may have. More than happy to answer, both from a patient perspective, scientific if I can, or or just advocacy, from an advocacy perspective as I can. Any questions, Christine?
I don't see any in the Q&A. Fatima, did you had a question earlier in our pre questions that we were chatting about?
Yeah. Thank you so much for sharing your story, Aristotle. I think it's really important for researchers, including myself as a trainee, getting really into the field, learning about sepsis, to understand the patient's perspective. So right before the session, we had a roundtable discussion with thought leaders, across the globe, on sepsis and things like that. So I guess I wanted to ask you, from a patient's perspective, what are the research priorities? What is it that you would like researchers in Canada to be thinking about, whether it's, in terms of getting sepsis, or sort of what you've been speaking about, that's post-sepsis care? What are sort of the three most important things that we should be thinking about or should be considering? And feel free to speak to that as it relates to obviously the research, but also how these three components can be utilized at the policy level, or to inform, clinical care. So feel free to touch on whatever you think is most appropriate.
Yeah, no, absolutely. So I think, learning about it myself, after the fact, when I started to sort of think about taking really a hold of my care, I think that's important, right? For if there's patients listening, to really understand, how do I take hold of my own care, and how do I advocate for myself? So I think there's enough papers, I think scientific papers, to say, and again, from your research and everybody in the room's research, is like, how else do we identify sepsis, and how else do we prevent sepsis from happening? And all that is great and good, but in my case, as a person in the just going out about my day, myself and my family didn't know that I was coming down with sepsis, right? Until you get diagnosed with that is what you're actually that's happening with your body. it's attacking every organ in your body until, you either succumb to your own demise, for lack of a better word. Sorry about that. But I think, and I get it on the other side of that, I think there's also a lot of research, but I think what's missing is the actual translation of that research and what that the numbers say, that what the data says about, great, we found out that a lot of people who go through the sepsis journey has developed post-sepsis syndrome. They have depression, they develop mental health issues, they have these long-term effects. That's great that we know that, but what are we really doing about it, right? So have we looked at a study of people where we shared their entire, care in following a group of patients to say, okay, this group, I mean, it's probably, like not so much like a rat A, rat B kind of situation where it's like, well, this group, we educated their care for post-sepsis. So we identified that they will have mental care or mental health issues. So did we get ahead of that, and our clinicians knowing the data to say many people with that's gone through sepsis will develop mental health issues. So are we being proactive? And when we became proactive, what were the results? Were we able to address those issues, before it actually developed to something where it's too far for the patient to actually seek support? So instead of sitting and waiting from the clinician side, instead of sitting and waiting, oh, now you've developed, oh yeah, we know this from data that you will develop mental care or mental health issues. But have we looked at, had we gone in before that, before the person identifies having a mental health issue, that did we prepare the person to identify those warning signs to say, it looks like I may be getting on some, some health issues here, some mental health issues here. And you as a clinician now go, I'm seeing a pattern here of maybe developing that. So let me educate the patient and let me advocate for that patient to make sure that they receive care. I think that kind of study may be lacking. I haven't seen much of that, we had this group A that we educated them along their journey instead of, oh yeah, no, we knew you were going to develop these other issues, but we can address it now. Because I think from a policy perspective and from a health spending perspective, we look at it from limb loss as well. If you prepare the patient earlier on in their journey, you're less likely to spend more money troubleshooting as you go. And and I'm going to speak on the limb loss here a little bit. If you prepare a patient, set them up properly with physiotherapy, with the appropriate physiotherapy and with the appropriate prosthetics and prosthetic care and setup, you're more likely to get that person more active back into their social fabric. If a person is as active as in their social, not only in their social life, but active in their sport life or recreational life, then maybe they'll have a better quality of life, right? And we can see that, and those things are measurable now. And I think that same goes for sepsis care. If we set up the person so that they know what to look for, and as clinicians know what to look for when we're dealing with patients, instead of waiting for them to complain, to say, I have this issue now, we can then proactively say, hey, this might happen. These are the things you can do to avoid it from happening. And so from a healthcare cost perspective, we're now looking at an overall care instead of individually troubleshooting as we go. One of the things that happened with me that was unknowns to anyone was about 10 years after my bout with sepsis, I had a heart attack. And they can figure out why I was having a heart attack. Like you're in your 30s, so this can't be happening. What is going on, right? And no one in that care team at the time, even though they knew historically that I had sepsis, was not connecting it to sepsis until somebody said, you know what, he had sepsis 10 years ago. Maybe it's from that. I think the lessons that could be taken from that is 10 years ago, we know that one of the post-sepsis syndrome or long-term effects could be an organ dysfunction. He is more susceptible to heart issues. Maybe as we progress in looking after him, and now he's not mobile, he's gaining weight, he's not exercising, he's not eating healthy. he's not identifying as somebody who's having a mental health issue, but it's clearly the signs were there of, if you talk to me now, you probably could tell. But then during that time, I was like, I don't want to go out with my friends. I just want to sit here on the couch. I just want to watch TV, eat junk food, and literally it. And then, so now you have two things of, is it really sepsis or is it because of unhealthy choices? Right. And so now we don't know, had we set up this person to succeed in getting the person a healthier lifestyle, because we know later down the road, they're going to go through some organ dysfunction, the cost of taking care of me and the risk of me dying from that heart attack would be a lot less, I think, if we educated that person. So I think from a policy cost-wise perspective, that's what we got to look at. Like, what is the cost of troubleshooting when it happens? And then what are the savings if we advocate for this person and their health from the get-go? I know that's a bit long, but I don't know if
No, thank you. We have a few questions in the chat box, and we only have a few more minutes left in the session. But one of the questions is from Dr. Allison Fox-Robichaud. Aristotle, what were some of the supports that really helped you recover from sepsis?
So again, that's very interesting, is in that at the time I was going through it, there was none. I could, again, I think that's all stems back to the lack of education and lack of the knowledge that's available resources wise to me. I left the hospital knowing only that I now have surgeries to do corrective ones. No one explained what sepsis was to me at the time, and this was years ago, right? This was back in 2001. So maybe there's some progression in how we address sepsis, and that could be something that we could look at from a policy perspective. But as soon as I was released from hospital, that was kind of it. It's like, oh, now we troubleshoot whatever is happening. But as far as support goes, I didn't have any resources available to me. And to be honest, I was even ashamed to admit that I had sepsis. Even just from a couple of years ago, when people say, oh, how did this stem, how did it come about that you had an amputation? I always say, well, I had a bone infection. It's like, oh, I had blood poisoning. I couldn't say the word sepsis because there was, for some reason, there was a shame attached to it for me. And I think that comes from the lack of education and the lack of the knowledge of what I was dealing with, right? And so hopefully, what Sepsis Canada is doing and the efforts that y'all are doing is that there's the resources that would be available. So peer support, I think, has been very important and been very helpful for me now that I experienced limb loss, and certainly, providing patients with the right terminologies, providing them the resource, providing them the knowledge so that they can advocate for themselves. Because I always think that you have to look after you too, and not just rely on your clinical team to say, this is what's going on. I think you had to do a bit of fact finding yourself. And to be honest, again, I didn't realize that for myself until I took hold of my life and say, I got to do something else because this is not working out. And to me, that was the biggest mind shift to change my life, right? And that's when I, became active. That's when I got back into my sports. That's when I started looking for resources and outlets to get where I am today. I did that because I think if we don't do that, you're just left to, well, this is what I'm told and this is what it is. And so hopefully, again, I think getting that in at the door as the patient is leaving the hospital, this is what you're having. This is what you're looking to experience. Having that conversation and having those resources available will be really helpful in someone's journey.
Thank you. That sort of touches on a couple other the questions that were in the chat. I will read them just so that they know that I didn't skip over them. So one of the questions was, what would you say were the biggest information gaps you experienced in the hospital and in post-sepsis care? What do you wish could have been done differently by your healthcare teams over the course of your care, and particularly in post-sepsis care, particularly to ensure better continuity of care and informed care? And I think you touched on a number of those things in there. And then one of the other comments was, I feel like there needs to be safeguards in place to help people navigate the things they don't know. Being in hospital is confusing and difficult, especially when you or a loved one is sick. But when you're there for the first time or for the second time with a new condition, it's hard to know what to do or what to ask. Do you think there's a better way to help patients become knowledgeable about their questions they could ask to better understand their care during and after their hospitalization?
Right. I'll just answer that really quickly. I know we're short on time here, but I think one of the things that for me has worked with the limb loss community is that being attached to hospitals that look at that performs a lot of these surgeries, and we have hospitals here in Toronto anyway, in the area, where they know that when they get an amputee that comes in or a person who experienced limb loss that comes in, they'll say, you know what, let's get Aristotle to come in and talk. Right. So the hospital knows and the care team knows that they have a resource to go to. So I think to provide that peer support and somebody willing to provide that peer support. So that could be something that Sepsis Canada could certainly look at, and anyone else in the world listening to it, is that if you have that volunteer opportunity or volunteer group that says, hey, you know what, I'm willing to talk about my journey. And this person comes in and you know that they've been diagnosed with, with sepsis, it's like, you know what, let's talk to Aristotle, who's gone through this journey, and get them to speak to the patient if the patient is willing, or their family, to learn more. Interestingly enough, that happened to me as well in sepsis after my sepsis. 3 years later, after I've left the hospital, somebody my age has come in, and the person was a guitar player, and he lost all his fingers. And he said, let's get him to talk to Aristotle. And I wasn't an amputee then. I wasn't, but they would, the thing they said to me was, we provided them the exact same care that we provided for you, because we learned from our experience with you the kind of care that this type of case would need. And so we'd like for you to speak to the family, just to tell them what to expect in the journey. And then for that patient to also feel that, to see you walking in and saying, no, I was okay. You know what? I'm okay now. You just got, I think hopefully that helped that person a lot. And I certainly know from the limb loss perspective, that has really helped a lot of patients who in the limb loss community to realize from themselves and self-actualize really that there is something beyond what they've just experienced. It's life-changing, right? So you got to see somebody who's been through it and maybe still going through it, but understands it. And when you take the clinician words out of it, it allows them to open up more and have that regular conversation without feeling like, I can't be asking that because I'm going to sound stupid.
Well, thank you. And on behalf of Sepsis Canada, I'd like to thank you, Aristotle, for joining us and sharing your story. And thank you to the audience as well. We hope you enjoyed our presentation. There is more information about Aristotle and his journey with being a para-athlete. Michelle, I'm sorry I didn't get to your question in the chat there, that you can learn more about Aristotle. We have to jump out of this one and get back to our scientific meeting. So thank you so much again, Aristotle, for joining us today. And thanks for everyone for coming.
Thank you.
Thank you.